Hello everybody. In this session we are going to see about the standard precautions which is to be followed in any individual who get admitted into the hospital. So what is standard precaution? Standard precautions are all used for all the patient care. They are based on risk assessment and use of PPE to specimens as well as to protect the healthcare worker from hospital acquired infection. This should be followed on all times when attending all the patients. All might be you draw a sample or specimens, or might be you're using any during the procedure when you're using any needles or sharp items. So standard precaution, which is a standard guideline which is universally followed, is like the black texture with the yellow background, which is always following the standard precaution. So in this you have 8 major components, and the first component would be performing hand hygiene before and after every patient contact. Might be we have to maintain the 5 moments and the 7 steps of hand washing whenever we deal with the patient. The second would be cleaning and reprocessing of shared patient equipment. Might be you use a stethoscope. Then we have to decontaminate the diaphragm and the bell of the stethoscope when we are going to another patient for chest auscultation or might be a bowel auscultation. Then using of PPE and equipment when at risk of any blood or body fluid exposure. Following the respiratory hygiene and cough etiquette, so see that whenever we cough, we are going to use our elbows and cough, not using the hands, and closing the mouth. Using of and disposing of all these sharps very safely, not injuring to ourselves or to the other personnel. Using aseptic techniques throughout the procedure whenever there is a chance of invasive procedure to the patient. Perform routine environmental cleaning, so frequently mopping the floors and cleaning the floors, and handling and disposing of waste as well as using the linen safely. All these 8 major parameters play a major role in maintaining the standard precautions in a hospital. So these are the guidelines which is given by the WHO, which is wetting the hands, then applying the solution, then palm to palm we are going to rub the hands, then we are going to do the right palm over the left palm and left palm over the right palm with interlocking, and then we are going to do the interlacing, that is using the fingers opposing the hands, then rubbing the back of the thumb as well as the other thumb in vice versa, then doing the fingertips and then rinsing with water. Then you're going to dry the hands either with the hand dryer or maybe you use the tissues and close the faucet, and hands are safe. Then we also follow the movements of hand wash, that is before touching the patient, after touching the patient, before clean or any aseptic procedure, after blood and body fluid exposure risk, and after touching the patient's surrounding. So we also need to maintain the PPE. So these are the common sequence of donning and doffing of a PPE. So the more common PPE, that is personal protective equipment, would be gown, mask or respirator, goggles, gloves. So when we are going to do the donning, that is when we are going to initially wear the gown, then the mask, then we also wear the goggles and gloves. And might be if you're going to remove, then we are first and foremost would be the gloves to be removed first. Then you're going to remove the face shield, gown, mask and respirator. Then maintaining the cough hygiene and cough etiquette, that is covering with tissues or might be with the elbow, we are going to cough it, and then we are going to do the hand washing. And these are the safety tips while you are using the needles or sharps. See that before the procedure how you do, after the procedure how we do, as well as during the procedure. So safe handling of equipment, keep the handling of sharps to minimum. Do not recap, do not bend or break the needles after use. Discard each iron needles into the sharps. Do not overload the bin, and do not leave the sharp bin in reach of the children as well. So to conclude, standard precautions is essential throughout the care in a patient when they are getting admitted into the hospital. And that's all for today. Thank you all. Try to follow the standard precautions starting from your student period itself. Thank you.